Hello everyone, I am Sundas Sattar from Pakistan. Today I am presenting our research proposal. The title is Integrated Surveillance Framework for Early Detection and Prevention of Zoonotic Diseases in Urban Communities, a One Health Approach. In this study, we focus on improving early detection and prevention of zoonotic diseases in urban areas through a One Health approach, which connects human, animal, and environmental health. I would also like to introduce my group members and acknowledge their efforts in this project. Our group members are Saban Khan from Pakistan and Solangia dos Santos, Borges from Tamil. In this presentation, we will cover four main areas. First, the background and problem, where we explain why urban one health surveillance is urgently needed. The second one is our approach, including study design, multi-sector data integration, and machine learning-based early warning systems. Third, the key innovations and expected outcomes of our framework. And finally, the deliverables, including policy outputs, tools, and scientific contributions. Zoonotic diseases is a growing global threat. Zoonotic diseases are infections that are transmitted between animals and humans. They represent a major global threat, a global health threat. Around 60% of non-infectious diseases and 75% of emerging infectious diseases are zoonotic in origin. More than 30 new pathogens have emerged in the last 3 decades, causing a significant global health burden. The COVID-19 pandemic clearly demonstrated how quickly zoonotic pathogens can affect global health systems, economies, and societies. Why urban communities are vulnerable? Urban communities are highly vulnerable due to several interconnected factors. High population density increases transmission speed. Human wildlife interfaces in urban areas increase the risk of cross-species pathogens spillover. Free roaming animals and wet markets further increase exposure risk. In addition, climate-related challenges and poor sanitation systems also contribute to disease spread. One Health framework connects human, animal, and environmental health. It emphasizes integrated surveillance, shared diagnostics, and coordinated interventions. By linking these three sectors, we can detect outbreaks earlier and respond more effectively. This framework is essential for preventing future zoonotic outbreaks. Despite advancements, there are still major gaps in current surveillance systems. Most systems are reactive rather than preventive. Urban-specific research is limited, as most evidence comes from rural settings. There is also a lack of real-time data integration across sectors. In addition, financial and technical constraints limit implementation in many urban areas. The main objective of this study is to develop an integrated surveillance framework for early detection and prevention of zoonotic diseases in urban communities using a One Health approach. Key secondary objectives include identifying important indicators and data sources, evaluating a digital integration platforms, developing machine learning-based early warning systems, incorporating event-based surveillance data, and conducting economic evaluation of this system. This study will use a mixed method design over 16 months. It includes for phases. First phase is we could, it includes 4 phases. First phase is we collect literature review, site selection, ethical approvals, data mapping, and the second phase two, quantitative and qualitative data collection, stakeholder engagement, framework development, ML model training, multi-omics analysis, validation plus policy recommendations, disseminations, and final reports. We'll collect data from multiple sources. Human health data will include clinical surveillance and lab confirmed cases. Animal health data will include veterinary reports and wildlife sampling. Environmental data will include wastewater, air, and water monitoring. We'll also use digital data sources such as Google Trends, social media, and news-based surveillance. This study introduces several key innovations. A real-time digital surveillance platform will integrate all data sources. Machine learning tools, machine learning models will help predict outbreaks. The wastewater surveillance will detect pathogens at community level. Multiomics analysis will identify early biological markers of spillover events. Expected outcomes. We expect to develop a validated One Health surveillance framework. It will improve early detection and outbreak prediction using integrated data systems. It will also strengthen our collaboration between human and animal and environmental health sectors. Ultimately, it will improve pandemic preparedness in urban settings and support global health goals like SDG 3 and SDG 11. Key deliverables and future implementation. The final deliverables include digital One Health surveillance platforms, real-time dashboards, and alert systems, policy recommendations for multi-sectoral coordinations, standardized protocols for wastewater and multi-omic surveillance, and scientific publications, scalable models that can be applied in other urban settings globally, and conference presentations. Thank you so much for your time, and thank you so much for watching.